ASH is above all a change agent, a campaigning organisation which has made an enormous contribution to reducing smoking and its harms not only in the UK but globally. Its achievements, your achievements, have relied on evidence-based policies, highly professional advocacy, strong coalitions, good information programmes and persistence in the face of powerful and cynical opposition. What would I highlight as a great achievement of ASH and why? Tobacco is such a good example of the saying that overnight success takes time. Just look at where we are now as compared with 1971. Close to half of adults were smokers. Smoking was still increasing in women and children. Cigarette advertising and sports sponsorship were everywhere. Smoke-free areas were hard to find. The tobacco industry was dominant, respectable, and actively denying the evidence and just lying everywhere. Of course there's still work to be done, but the world has changed dramatically. But the greatest achievement, for me, it's the numbers we won't see, the toll of mortality and morbidity that won't occur in the years and decades to come.
ASH, to me, is the most influential lobby group of our time. They're creative, they're persistent, and they're hugely effective. And the past 50 years, they have turned the tide of public opinion about smoking. And as a doctor, I am so grateful. ASH have robustly distilled the evidence around smoking to develop sensible, pragmatic, realistic policies so that medical organisations such as the Academy of Medical Royal Colleges and the Royal College of General Practitioners can rely on them. They've led the coordination of position statements on public health, which in turn we can all get behind. Our shared priorities could be articulated and incorporated into whole system change. But I think that ASH's greatest achievement is to have turned the tide of public opinion against smoking, and that is an enormous thing to have done. Please keep going, ASH. We're not done yet. I look forward to bringing the Academy of Medical Royal Colleges with you until we have eradicated smoking from our society forever. Thank you and happy birthday, ASH.
In my opinion, ASH's greatest achievement is the important role that it played to help bring about the introduction of the smoke-free legislation. From a professional perspective, ASH's greatest achievement is how it continues to remain relevant to me in helping equip me with the tools and the evidence that I need to do my job on a day-to-day basis at local level. And in terms of what ASH should do next, I think ASH should focus on ensuring that the government delivers on the smoke-free 2030 ambition. But ASH is always very good at being one step ahead. And so I think that there are issues we now need to think about, which I hope ASH will be able to look at in terms of any social, economic, and political implications that may have been exacerbated by COVID.
ASH is a highly effective campaigning organisation. It's unwavering in its commitment to tobacco control, which unites stakeholders across the sector towards our shared goal of making smoking obsolete. I believe that ASH's greatest achievement is the influential role it played in the publication of the Smoking Kills, Beyond Smoking Kills and Smoking Still Kills reports. These influential reports identified campaign priorities, not only for Cancer Research UK, but also for the Smoke Free Action Coalition led by ASH more widely. I think importantly, these reports also formed a strong framework for tobacco control for multiple successive UK governments, and this paved the way for world-leading progress made by the UK in reducing harms from tobacco. ASH, through the Smoke Free Action Coalition, must continue to be at the forefront of putting the case to the UK government that achieving smoke-free ambitions across all demographics should be central to its levelling up agenda. Secondly, ASH should play a key part in CRUK and the wider public health sector's impetus towards achieving a cohesive, cross-risk factor approach to tackle NCDs like cancer.
ASH is known globally as an effective voice for stronger and more effective action against smoking. I've seen this over and over again throughout the years in ASH's work supporting the Framework Convention on Tobacco Control, the Global Tobacco Control Treaty. And over the years, I've been so impressed that ASH understands the value and the importance of research evidence to move forward measures to fight smoking. And it's really been a privilege for the ITC project to be working with ASH over the many years to bring our evidence and those of others to advocacy and to governments to strengthen and accelerate action toward fighting smoking. So ASH, thank you so much for your 50 years of extraordinary service, not only in the UK, but throughout the world.
So for me, ASH is the voice of conscience around smoking and tobacco control, and that really, really important voice all the time, whether it's industry, government, policymakers, the public, clinicians, really reminding us that we can avoid all those deaths that we see from tobacco.
As a clinician, ASH have always been my go-to organisation to understand tobacco control and how I can help my patients quit smoking. As my role as RCP Tobacco Advisory Group Chair, I also go to ASH for their thoughts on what the most impactful reports we can write are and how to use the reports to implement policy change. As an ASH board member, I've been privileged to see the drive and the purpose and the efficiency in changing policy around tobacco control and the saving of millions of lives over the 50 years that ASH has been in existence.
ASH is an absolutely brilliant charity that punches well above its weight when it comes to campaigning on tobacco issues. Probably the most significant thing that ASH has helped achieve is the 2007 ban on smoking in public places and indoors. That's been an absolute game changer when it comes to improving the health of successive generations. And what I hope that ASH will continue to do is work to eliminate tobacco completely, to make smoking history. That would be an absolutely amazing achievement for a small, dedicated and fantastic team of people.
Public health professionals recognise the highly effective work that ASH has delivered since its inception, and we share a common belief that prevention is better than cure. Faculty members strongly commend ASH's work. They've been excellent at producing evidence-based and accessible information. These resources are key in helping our members of the faculty influence and inform tobacco policy. We look forward to continuing to work with ASH to prevent avoidable harm from smoking and to tackle those really, really deep health inequalities that exist in our country. So congratulations to ASH, congratulations for all you've achieved to protect the public's health over the last 50 years, and I wish you all the best for the years ahead.
It's an amazing story because the amount of money ASH has to campaign must be less than 1% of what the tobacco companies have to spend in fighting ASH. And yet, every single time, ASH comes out on top. And it's the rigor of its research, of its information. ASH never cuts corners. It never cherry picks the data as many campaigns do. ASH plays it straight. And that's one of the reasons why ASH has got so respected in Whitehall, at Westminster, in the media. Because if ASH puts out a piece of information or a statistic, the journalists, the civil servants, the politicians can be confident and are confident that it's right. And I think this rigor has played a huge part in ASH's many campaign successes.
ASH is an incredibly effective advocacy organisation in tobacco control, both in the UK and internationally. And in fact, it also carries real weight within the wider public health community and advocacy arena in the UK. I mean, its policy successes are innumerable: smoke-free policies, standardised tobacco packaging, tax reforms. And really, it's thanks to ASH that the UK is consistently top of the rankings in European tobacco control. My work focuses in particular on the tobacco industry, and we have been working with ASH over many years, and ASH has played a really key role in pushing for really strong implementation of Article 5.3 and in monitoring the tobacco industry and holding it to account, and done incredibly commendable work in that area.
ASH is a tiny but mighty catalyst for change. A small team of passionate experts and, importantly, expert coalition builders dedicated to finally ending smoking and holding the tobacco industry to account for the devastation it causes. As to what ASH should do next, achieving a smoke-free 2030 fund through an industry levy is essential. Any new strategy will fail if it's not effectively funded.
Look, if you look over the last 50 years that ASH has been in place, smoking prevalence has come down really dramatically. Not all to do with ASH, of course, but having pressure groups like ASH is inevitably helpful in doing that. ASH was at the forefront of getting advertising off our screens and away from the general public, and reducing or getting rid of tobacco sponsorship. Getting rid of smoking indoors. In all of these things, they take time, but they have changed beyond recognition in the 50 years that ASH has been in existence, and in the slightly more than 50 years that I've been in existence. Smoking has come down, smoking prevalence has come down a lot, but it remains the case that there are still far too many people suffering from the consequences of smoking. I think ASH needs to continue to be at the forefront of the campaign against the misuse of tobacco, and to look forward to the next 50 years. Hopefully in 50 years' time, there will be no need for ASH because we will no longer be using tobacco products.
ASH is a valued partner of the BHF and a real champion of public health policy because it holds such expertise and relationships at all levels of the system and has truly supported the sector to drive major impactful change in smoking policy and subsequently many improvements to health. There are many achievements in ASH's 50-year history, but spearheading sector-wide influencing to secure that ban on smoking in indoor public places that came into play in England in 2007 must be one of the most significant, because it has had a considerable impact on cardiovascular health. We know from our own research that there were 1,200 fewer hospital admissions for heart attacks in the year following the ban. And this monumental legislative change could not have been achieved without ASH's role in leading the sector and laying the groundwork in the first 35 years of its life. So looking forward, ASH should continue their work with government and the sector to ensure that the forthcoming tobacco control plan keeps tobacco control on the agenda and sets out a strategy to achieve the ambitious smoke-free 2030 target for England. So the tobacco control plan and all of government's future policies must have a focus on reducing smoking inequalities, which we know are deeply ingrained in certain communities. Without doing so, we know we will not ensure that health benefits of smoking reduction are felt across the country by everybody, wherever they live and in whatever communities. And this includes ensuring, of course, that everybody has access to adequately funded stop smoking services. So developing the evidence and building understanding of how best to support smokers in these groups will be critical, and we know that ASH has both the expertise and presence to play a vital role in this.
When my work with ASH and Cancer Research UK was described by a president of the NFRN as working with the enemy, I knew that I was doing the right thing. As a retailer of tobacco for nearly 40 years, I can look back at how far tobacco control has advanced over that time. There have been many successful battles, but the standout one to me has to be the 2007 smoking in public places ban. That was when a corner was turned and smoking became accepted as the wrong thing to do. As to the future, well, we have come a long way in the last 50 years, but the war against tobacco isn't won yet. Getting over that finishing line where smoking becomes history remains a formidable challenge.
In many ways, to me, I think the greatest achievement of ASH has been to continually advocate for and attain greater taxation of tobacco products so that the price for consumers actually increases and hence they are deterred from using tobacco products. Going forward, I would like to see ASH continue this work so tobacco continues to get more expensive and hence more people are deterred from using expensive tobacco products.
In my time as a Member of Parliament, I have to say that ASH always impressed me as being one of the most effective campaigning organisations, working alongside parliamentarians, really equipping us to be able to make the case for action on smoking and health and delivering some quite amazing change in the landscape, whether it's in legislation, whether it's in behaviour, and continuing to drive down the rates of smoking in this country, but never ever giving up and never ever being complacent. And I think that's what I've always admired about ASH, why I'm proud to be a trustee of the organisation today, and why I'm proud of the work it's been doing, particularly in mental health, to really drive the agenda there. So thank you all very much. Great team, great leadership, great progress, but still so much more to do.
Great achievement. I'm going to talk about the one that's personally best for me, which is the ban on smoking in public places. We did a case study of this early on in the Institute for Government's life. And what was really interesting there, I thought, was the way in which ASH formed really interesting alliances to lobby very successfully for a change of policy that the government didn't want against a government with a big majority. So it was a really interesting example of working smartly across boundaries, establishing common interest, but also very effective parliamentary lobbying and use of the Health Select Committee there. What should ASH do in the future? I think that's quite easy. ASH needs to keep on with its emphasis on making sure that tobacco control policies in the UK stay evidence-based. I think that's allowed openings in the UK, particularly on things like a much more sensible, pragmatic attitude toward e-cigarettes than we see in lots of other countries that we might otherwise think are quite similar. So ASH should keep going on that.
That ASH is David to the tobacco industry's Goliath. What matters is not size, it's courage and commitment. Now the tobacco Goliath has been stunned, but we need a few more stones from David to finish it off. I think ASH's greatest achievement was helping parliamentarians to mastermind the ban on public smoking earlier on in this century. And what ASH did was to build an alliance between the political parties, provide that alliance with information. It helped draft the necessary amendments, and also it did, crucially, it did some preparing of public opinion by showing that public opinion was behind the proposed ban, contrary to all the efforts of the advertising industry and the other industries to show the opposite. I think that was a key moment in the battle against tobacco in the United Kingdom. I think the next battle for ASH is to establish the principle that the polluter should pay and generate more funds for the first-class health education work that it's doing. So there is a more even match between the resources of the tobacco industry on the one hand and the health education lobby on the other. And the second thing I think it needs to do is to work with its sister organizations in other countries, which haven't been so successful in fighting the scourge of tobacco, by showing what can be done with a well-briefed, well-organized lobby organization to counter the propaganda from the tobacco industry.
Gosh, Ash in a sentence: power, people, passion. They're just phenomenal. I have to say, I think that Ash is, they're very modest. They'll say one of the most successful national advocacy organisations. No, globally, absolutely. Just passionate and very much about people. And their heart is all in this. So, yeah, perfect. Perfect, actually, perfect. And I think for me, it's 2021, and we are within that slither of a grasp that we can make smoking history. That would not have helped. That would not have happened without the leadership of Ash over the last 50 years. And, for me personally, the last 20 years, when I just feel so honoured and grateful to have worked so closely with what has just been a dynamic team. Well, I love on many slides that Ash uses, they use the acronym KBO. So in my head, I've been told a million times, working with Deborah, Hazel, their wonderful team, keep buggering on.
Ash has been the standard bearer for the battle against the tobacco industry and the terrible things that it has brought about in this country for many decades. In my own field, the law, I've been looking for 30 years to bring claims against the tobacco industry, and Ash has worked tirelessly alongside me throughout that period. Whenever I've needed their help, they've been there. Whenever I needed support in any sort of way, they would only be too happy to give me the assistance I need. They're a great organisation, and it's been a fundamental part of my work, and indeed they're a fundamental part of the fabric of this society in trying to make sure we rid ourselves of the scourge of tobacco.
Ash is an international leader in tobacco control, and they have been for 50 years now. And in the 20 plus years I've worked with them, they've been consistent in taking a strong evidence-based position and then leading the rest of us to draw on the evidence and to advocate for change. They really have been the driver of reductions in smoking in the UK, calling for government action and evidence-based practice. Where should Ash go next? Well, the problem has not gone away. We still have millions of people who smoke in the UK and many, many more around the world. I hope that Ash will continue to be well supported and also to advocate for population level policies. And in particular, I think as we move and continue to make progress on reducing smoking, issues around inequalities, mental health, and the groups that are most affected absolutely have to be front of mind.
For me, Ash always has been and still is, and doubtlessly will continue to be, persistently effective. The greatest achievement of Ash surely has to be that Ash was a leading partner at the time that the Labour government introduced smoke-free legislation. It was a major shift in this country and a huge contribution to the health of the nation, and Ash correctly should be very proud of that. Ash should keep on doing exactly what it does and what it does so well. Ash needs to continue to identify ways and promote the ways in which we can work together to create a smoke-free nation, to support people in their quest to give up smoking, and also to make sure that we improve people's health and well-being, because that will be one of the greatest determinants of equality across the country.
Ash is an inspiration to us all. As a charity, it's probably saved more lives and reduced the burden of disease for more people than any other charity I can think of. Going forward, what should Ash do? Well, they're such a successful charity, maybe they should think about tackling some of the other great ill health burdens that we face: obesity, alcohol misuse, and the increasing effects of climate change. But maybe Ash, stick to smoking, as we're not done there yet. Happy birthday, and thank you.
Ash is a group of dedicated people raising awareness of the dangers of smoking and fighting for our future to be smoke-free. Ash should continue the fight with polluter pays. They should pay. They duped so many people into smoking, knowing it was addictive, knowing it caused cancer. Why should they be let off? Continue with the fight. Polluter pays.
Ash has managed to get the cause of stopping smoking onto the national agenda and has convinced political parties of the need to act. And their success has resulted in really quite dramatic reductions in levels of smoking in the UK, which outpaces what most other countries have achieved. Ash should continue to fight for a smoke-free society, and their advocacy of vaping as a way of stopping smoking has already saved so many lives. They should continue to make that case and to hopefully persuade other countries to follow the lead of the United Kingdom.
If I had to sum up Ash in a sentence, I would say not only have they been and are they a very successful campaigning organisation, but they're also a coalition on smoke-free issues, which have allowed many other organisations to be much more effective than they would have been on their own. And that has allowed huge changes that we wouldn't have seen otherwise. Ash's greatest achievement, I think, is getting smoking banned in public places. That was an amazing result, requiring a lot of collection of data, engagement with the public, and getting a coalition of many different organisations, both within healthcare and without, to achieve that. I think they've managed to do all of this without demonising the smoker and putting the onus on the tobacco companies themselves, which in itself is another great achievement. What should Ash do next? Don't stop, keep going. The pandemic has shown us that you can never rest on your laurels, particularly when it comes to smoking and the harm that that causes. And there's going to be a lot more work to do, and people will get distracted both by the pandemic but by the business of the NHS. So we must not stop and we must keep going.
Ash is the heartbeat of tobacco control. I'd like to highlight the value and the impact that Ash has had both regionally and locally. And you know what, we wouldn't have been able to do half the things that we do without Ash. I was looking at the Ash vision over the last 50 years, and it says to eliminate the harms caused by tobacco. And I really see no reason at all to turn the ship around now.
Working for Ash is a privilege and an honour. When I started, I never imagined that while I was still here, the end of smoking would be in sight, with a government commitment to make England smoke-free by 2030. Our birthday celebrates 50 years of success, but our staff, though brilliant, are small in number, and on our own we would not have got very far. We value our partners, the RCP, who set us up, to be evidence-based and always looking for the next campaign. We were started by clinicians and academics, but Ash soon expanded out to the broader health community. The British Heart Foundation and Cancer Research UK are the core, providing us with essential funding as well as support. Built around that is an alliance of over 300 organisations, health charities, local authorities, NHS colleagues, public health experts. You all contribute to the success of Ash. We would not be where we are today without you. And personally, I am one of Ash's success stories. When I joined, I was still a social smoker, kidding myself, like many do, that I'd given up. Ash finally put an end to my addiction and fueled my passion to help others do the same.